Greetings and thank you for joining me for today's Innovations in Facial Plastic Surgery Update. I'm Dr. DJ Verrett. Today we will briefly talk about forehead or brow lifting techniques. There are several different methods that are used to lift the brows more in a natural position. As people age, unfortunately gravity takes its toll and the brows can end up drooping. In some cases, people can actually have difficulty seeing in the top part of their vision because of a low-hanging brow. In a man, the brow should be right along the top of the bone called the orbital rim. In a woman, the top part of the brow should be about 1 centimeter above the orbital rim in a soft curving arc with the peak again about 1 centimeter above the orbital rim. Now there are several different techniques which can be used to raise the brow into a more natural position. One of the most commonly used today in cosmetic surgery is the endoscopic brow lift. In this technique, incisions are made in the hairline, generally in the middle, and one on either side, just behind the edge of the hairline, and an additional incision is made along the edge of the hairline. Through these incisions, the forehead is elevated off of the bone. The attachments of the forehead to the bone around the eye are detached, and the forehead is pulled up. There are several different methods for holding the forehead in a more natural position until things heal in. Each has its own benefits and its own risks, and it's definitely surgeon's preference as to which is being used. The next type of incision which can be made is through the upper eyelid blepharoplasty, an incision made along the natural eyelid crease. Elevation is undertaken again to the orbital rim, the top of the bone. Everything is lifted off of the bone through this incision and the brow is pulled up. One downside of this is that the forehead does not get pulled up. The brow merely gets elevated into a more natural position, so it doesn't do as much to address the wrinkles of the forehead. An older technique, and one that is useful in some people, is a direct brow lift, where a small piece of skin is excised directly above the brow to pull things tighter. An incision is made in a very visible area. However, if people have deep deep forehead creases, it can be very well hidden. The last incision which can be made, which is used in some cosmetic applications, is an incision which is made all the way across the forehead just at the hairline. This is used in people with very high set hairlines in which an endoscopic brow lift would cause their hairline to be pulled even farther back. Through this incision, the skin and deeper structures are taken off of the bone. Again, the attachments to the bone are released. Everything is pulled up, excess skin is removed, and the incision is closed. With any one of these techniques, there are several risks which can be involved. There is always risk of infection, bleeding, bruising, and swelling. In addition, there is a nerve which comes out about right here called the supraorbital nerve. It provides sensation to the forehead and often the top of the scalp. This can be bruised or stretched during surgery, resulting in numbness, a lack of sensation to the forehead and the top of the scalp, which can be temporary or possibly permanent. In addition, there is a nerve which provides the motion for the forehead, which comes approximately in this area here. Depending on the technique used, this nerve can be at risk, resulting in a temporary or possibly permanent asymmetry in ability to elevate the brow and move the forehead. Again, this is a fairly small risk, but in some approaches is real. Additional risk can be gone over with you by a qualified surgeon who is experienced in brow lifting techniques. Depending on medical conditions, additional risks may apply. So be sure to consult with a well-known physician who is experienced in these procedures to be able to go over your individual risks and share with them your entire medical history, including any over-the-counter medications or supplements that you might be taking. I'm Dr. DJ Verret. Thank you for joining me this afternoon. For more information, visit my website at www.innovationsfps.com. Have a great day.